just to explain, we decide to inject. She's really concave here, and we need a lot of vials for sure. So we decide to give her the lifting effect, injecting at least 3 to 4 vials for begin here with these 3 entry points. We will have anesthetics here, and then we will inject with a fanning technique. We talking about how to inject. We decided to do this 3-point just to reach all the area with the 3D technique instead of using just one, not to spread the product in that part that they have a good concavity. For sure, she will need more treatment than one, but with 4 vials here and here, we could have always a good lifting effect that it's really appreciated by the patient at the beginning, and maybe convince also the patient to continue in the reshaping. As we said before, in this kind of buttock, we have to achieve a good result for the contouring. We need up to 3 sessions for sure, and injecting much more than 6 vials per side, but we can achieve the result little by little, step by step.
What are the intervals between the sessions?
Usually I used to wait at least 3 weeks to 1 month each session. It depends always also on how the patient is busy, for sure, because sometimes it could last some little bit, but for 15 to 21 days, we give the possibility to the product to spread and stabilize in the tissue. We inject, as we said altogether downstairs, in the deep tissues of the subcutaneous tissues. We don't go inside the muscle. And then maybe on the last session, maybe the 3rd or the 4th, we can use to shape in the most superficial plane MLF1 instead of MLF2. That is much contouring than volumizing. Okay? So we can...
But on the first session you would only use...
We clean before, then we draw, and we clean only the entry points, just not to spread all the drawing. As you see, when she lay down, it's really different, the shape of the butt. That's why we need to draw in the stand-up position. Usually we can perform it in our office with the same clippings. Okay. Okay.
Yeah.
Oh.
Choose
Yeah. All right. We feel each entry point. Excuse me. It will be a little painful.
Na stronie będzie.
Only 3 little. At the beginning, we feel with the fanning technique this area, and then with the 2 or 3, we feel the lateral part. Sometimes this part could be much more painful, but it depends on the patient. because here we could have much more septe than inside these areas. Usually you could also fill with 18G blunt cannulas 10 centimeters mono use. So this is MLF2, as we saw, is up to 10 cc per syringe. You will see how easy it's to push and to put the product. Instead, this macromolecular HA. I think we need the. Okay. Amazing. Okay. So we do the 1 entry point. Here when we go in the deeper tissues, we cannot feel the needle. Can we move a little up just because of my height? How do you feel? Good?
Good, yes. Okay.
Okay. This is maybe a little bigger.
You need bigger.
Yeah, we need bigger because this is. Yeah, this is. Yeah, it's 16.
So you need this one. You need this one.
Give me this one. Okay, maybe it's. Yeah. Okay. You see? We are here. This is the tip. We are in the deep tissues, as you saw. It's really easy to inject. With this fun technique, we go through.
The product is without lidocaine.
It's without lidocaine, yeah. A lot of people ask why, and the
Stabilizing.
the producer said this. Okay.
The bigger the molecule is,
Yeah.
the more problem.
And
it
also with this kind of large amount, you could have too many anesthetics.
and
Yeah.
distant side effects.
Yeah. As you see, it's really comfortable.
Depends on the patient.
No, I'm talking about how you press. How you press, and the pressure is not so heavy. At the end, I suggest to massage always. If later, maybe we can put some gloves so you can feel. How do you feel?
Good.
Perfect.
She thinks of the new buttons.
Yeah. In Italy, we say that if you want to look better, you have to suffer a little bit.
No pain, no gain.
No pain, no gain. Yeah, that's the same.
How it's in Italian?
Se bella vuoi apparire, un poco hai da soffrire. It sounds good. Okay. We inject the lateral part now. And you see, this is really smooth. And if you see from that side, you see how we improve. Huh?
No bumps.
No bumps, and we improve this part. Yes. Instead of this, that is really flat.
Yeah, from my perspective, it's
Now you can massage. You see?
Yeah.
If we have 18, this will not appear. Just this. So we have to be aware to use bigger cannulas. So because of the spread of the. We have the needle, where we have it. Here it is. Okay, we are quite ready.
Yeah.
Okay. As you see, we go easily. You have to fan without stopping any part. Okay. Sometimes I saw some doctors do the bolus technique, but in that case, I don't suggest to do bolus technique because, opla, oh, this is not good without the lever lock. The other cannula says the lever lock system is much better. Okay.
So you are tunneling first and then injecting, or?
At the beginning, yes. Then I'm injecting when I'm retracting.
Retrograde.
Always retrograde. Okay. If you have a glove, if you put some gloves, you can feel how it is smooth. And we don't have any.
You have just the rest of the product from the syringe. I would like to have it on my skin.
Yeah, yeah.
Just when you finish one.
Okay. So, Dr. Chris, you go from the other side?
Did you do
Usually, at the end, we use a steady strip here or just a little medication. I will show you maybe you can see here.
Yeah, I could see it here.
Yeah,
It's much smoother than macro.
yeah. It's smoother and you don't have all the little
Super.
nodules. If you see at the microscope, you see like a lawyer. Not comparing with macrolens when you see all smaller
They
particles.
had that technique of the same gel,
Yeah.
but they were pushing through the nuts.
Yeah,
The bigger the fish nuts,
Yeah.
the
that's
bigger
the bigger difference, the biggest difference between the two products. Sorry. And you know the end is not painful. Sometimes with macrolane, it happens that injecting a lot, that's what we expected to do, because we are working. Okay. I think it's
I'm generous.
yeah. At the end, we put this kind of adhesive. Just to cover the hole where we injected. And we go on the other side. Okay. Thank you.
Thank you.
To jest 30.
It's easy because it's the pressure, you put a really low pressure instead of talking of macromolecules.
Yeah.
Just doing like this. How do you feel? Sometimes one side could be, the second one it's always more painful because you are used to what you
Just
are
like
doing.
with the ears. You know?
Yeah. Okay.
I'm trying to mold, you know,
Yeah.
during the same procedure.
Yeah. If you mold a little bit,
Yeah,
it's
yeah.
better. Do you have a big demand for this kind of procedure? Or you're starting maybe?
No, comparing to the face,
Yeah?
it's nothing.
No, that's the same also in Italy.
We are doing, I don't know,
Yeah, sure.
dozens of faces a day.
But sometimes it's a problem of knowing it because some patients said, "Oh, you do also this." Maybe they saw on.
What is the major problem?
Yeah.
The season, 2 months, that girls can really show it.
Okay. Maybe yeah.
During the winter, you'll show only like
Yes, but also when we are in the Arabic nations that they are all covered, they require a lot because they are used to have a real the Kardashian one, and
We'd rather have slim ladies.
yeah, the European is different in
somebody
this.
was to start my order.
And the other
Yeah.
limitation is the price of the
Yeah.
procedure.
Usually, how much here you can charge for this?
Approximately same.
Okay, and for the face?
For the face, it's about
300 euro. Okay, it's the same. It's my pleasure. Here is much more concave. So we start like this, but at the end of the session, maybe we have to inject more. Also, maybe 30, 40 cc more.
Especially on the side.
Yeah. We don't have to go too much ahead because they could, here it's, the skin is really thin and you could have nodules. Yes,
I think this
you
is
see,
something, yeah,
it's the same. The curve is start improving. And in 2-3 weeks, you could sometimes double the result because of the water recalling and also the stabilization of the HA. The last one?
I put it a little more here on the side.
Okay.
Because the side are,
Yeah.
you know, here,
Yeah, here
especially
it's,
here, I will
we have much concavity than the other one.
To, że mogę mieć jakąś tam jest napis na strzykawce. Tak, żeby na tamtą kamerę był na...
Na te? Tutaj?
Tak, na tamtą kamerę, bo to nie będzie wtedy ładne. Jak będzie doktor strzykiwał, to też widać było napis. A to z napisem? O, to.
Co się nie robi dla kamery?
A bardziej napisem jeszcze do nas? O, to i powoli.
Zdążyła, tak, replay. Słuchajcie, tak naprawdę to jest super łatwa technika. Do tej pory robił to Chris, ja i Roger.
Do you have taping? Not the like tensoplaster, not this one, just to tape. No, it's just to fix. Also, yeah, maybe this. This could fix. Sometimes I use the thicker one, but it could go. Okay, we finish.
I would suggest.
Yeah,
I would suggest that here,
Yeah.
just one more here.
just one more, maybe here.
in this part.
Also, we can inject from here. Can we have one more of MLF2? One more syringe. So we inject here.
This and this part here.
We make the anesthesia here, yeah.
Yes, yes,
Okay, we move from there. The cannula is quite longer.
yes.
Otworzyć jeszcze jeden?
Yeah, yeah, one. Thank you.
On się makro się dziwnie wchłaniał, bo on w momencie, kiedy się wchłaniał, dostawały takie grupki preparatu, tak jakby było otoczone tak jak z kapsułek kontraktów.
Wait.
Do środka trafić, bo nie chciało rozpuścić. A ten, jeśli się dobrze rozprowadza w powietrzu,
Yeah, because
płaszczyźnie,
this
Se-
is like
Yeah.
this is just
Yeah, just for give all the.
yeah, yeah.
Ale jeżeli chcesz, to będzie tu. Rób tego jak najwięcej.
Okay. Yeah.
Yes.
Yes. You see
Yes, I think
how we
okay.
improve it?
Yeah.
Okay. At the end, we fix with that adhesive. When I talk about garment, it's maybe if you have one thicker than this one, it could be better.
Like foam.
Like in Italy we say tensoblast. I don't know if you have.
Tensoblast?
Tensoblast is the one is thicker. It's adhesive, but it's thicker. Yeah, the one that football players used to. Okay. Yeah, okay, it's okay. This it could. Yeah. Excuse me. This would be the most painful. Yeah, waxing. We fix for 2-3 days. I suggest to stay in place of the garment. We fix like this and then like that. Then if you wear garments like we use it for lipos, it could be really.
As always, the details are most interesting.
Yeah. It helps to stay in place and to avoid also the a little. Yeah, 3 days is enough. How long? 1 week to 10 days. When I made my last workshop in Finland, I had a model, and we do all the stuff. We do the garment and say, you don't have to move too much, don't exercise. On the evening, we have dinner all together with the distributors and the owner of the clinic like you. And then they took me in a club and we saw the model dancing. And I say, come on, you don't have to move. And she said, but this is dancing, it's not gym. Okay. It's not exercise.
Not very marathon.
Yeah. We can cut here.
Marcin? Bo już tak jesteśmy w końcu. Możesz zakończyć jakoś tam?
Jeszcze mamy jedną pacjentkę.
Tak,
Ten ciak, tak?
Sorry. Just
Yeah.
tak więc dla nas.
If we have
Małgorzewski?
just shears there. I don't know if because it's too long. Okay. Yeah. Here. Yeah.
Jak był jeden
Thank you. We cut here. Thank you.
My bardzo panu doktorowi dziękujemy. Panu doktorom. Bardzo dobre szkolenie. I właściwie od jutra, ponieważ mamy doświadczenie z
Okay.
preparatami, więc tak naprawdę
So if you wanna
zaczynamy.
feel and touch, you could you can touch just to understand that the product is soft.
Thank you very much.
It's my pleasure. Wait.